Yeah, my screen that's in front of me is not letting me see anything, so I'm looking off to the side, but that's okay. Hopefully they'll just be looking at the slides and not my face.
Is Whitney frozen? Oh no, she's there. Are we letting folks in?
Yeah, Emily, are you going to admit everyone? Welcome, everyone. We'll give folks about 1 more minute to join, and then we will get started.
Hey, everybody. I'm keeping an eye on the waiting room. I'll let, whenever you want to go ahead and get started with introduction, I can keep an eye on the waiting room and let folks in as they arrive.
Perfect. Thanks, Emily. Okay, it is 2:03, so let's go ahead and get started. Good afternoon, everyone. Thank you for joining for today's webinar on advancing inclusion of transgender and gender diverse identities in clinical education. We have over 70 folks registered today, and we are delighted to welcome such a rich mix of disciplines from medical and allied health professions to public health, psychology, and academic advising, and many folks from the community. So welcome. And just a few housekeeping notes. We are recording for those who are not able to attend today. So please keep yourself muted unless you are participating in the discussion. And we will pause for discussion at 2 points. So we look forward to constructive and civil dialogue during that time. Many of you submitted questions in advance, and if further questions or thoughts arise, you can put those in the chat throughout the presentation. And then lastly, our slides today have quite a few links in them. So we're including a PDF of the slides in the chat if you would like to access those links. And I'll ask my colleagues to go ahead and add the PDF of the slides to the chat now. So next, I'd like to introduce our presenters today. My name is Whitney Lindenmeyer, and I am an assistant professor in SLU's Department of Nutrition and Dietetics, and my research and clinical practice center on nutrition care with the transgender community. Katie Heiden-Rootes is an associate professor in SLU's Medical Family Therapy program. In her work as a family scientist and mental health professional, she specializes in the advancement of systematic theory, training and research on health and well-being of the LGBTQIA+ community and their families. And her work today is marked by the celebration of differences, engaging in difficult dialogue, and becoming comfortable in discomfort. Rabia Rahman is an associate professor of nutrition, our dietetic internship director, and department chair in the Department of Nutrition and Dietetics. Her research emphasis includes the advancement of nutrition care for all individuals free from stigma and bias, with a special focus on the care for the transgender population. Emily Buxbaum is an assistant professor and the director of clinical education in the Department of Speech, Language, and Hearing Sciences. Her clinical and research work is focused on providing quality clinical education and professional preparation to graduate students, as well as the delivery of evidence-based clinical services and voice and communication training for transgender and gender diverse individuals. Teresa Dromar is an assistant professor in SLU's Department of Family and Community Medicine. She provides gender-affirming primary care to transgender and gender diverse individuals and has provided extensive education on this topic to both residents and medical students. Her research interests include transgender health education, health equity education, primary care practices for transgender individuals, and the provision of pre-exposure prophylaxis. So my colleagues and I are part of the Transgender Health Collaborative at SLU, which we started in 2020. So we are just a network of researchers and clinicians working with the transgender community throughout SLU and our partner organizations. Our goals are to advance respectful, inclusive, and patient-centered care for the trans community, promote research productivity related to transgender health, and then thirdly, which is the focus of our time today, is to train future healthcare professionals to be competent in gender-inclusive practices through clinical education at SLU. So if you're interested in following along with more of our work, you can just Google the Transgender Health Collaborative at SLU, or we're also on Instagram now at transhealthcollab.slu. During our hour today, we will touch briefly on key terms, the health disparities impacting the trans population, 7 strategies to advance inclusion of trans identities in clinical education, and working with students who express resistance to learning about transgender health. And as I mentioned, we will pause for constructive dialogue after we present the strategies, and then again after the section on working with students who express resistance. So our objectives for today: by the end of this webinar, attendees will be able to articulate how training students is requisite to creating a pipeline of gender-affirming healthcare providers, identify practical strategies to advance inclusion of trans identities in clinical education programs, and discuss strategies and approaches to working with students who express resistance to learning about transgender health. So the strategies that we are going to be discussing today, these are really the meat and potatoes of this publication that we have linked here, which is a toolkit for clinical educators. And my colleagues are going to put the link to the toolkit in the chat as well, so it's very easy to access. So this toolkit is free to access, download, and to share. And in terms of how this was developed, the toolkit was supported by an inclusive practice grant from SLU's Reinert Center for Transformative Teaching and Learning. And we formed the content based on, we did listening sessions with the transgender community, current research on pedagogical approaches, and of course, the content expertise of the authors. We've also had the privilege to partner with a number of transgender activists and educators who are authors on the toolkit and informed the strategies that we are presenting today. And then lastly, I'll just note that the toolkit was illustrated by a designer from the queer community. So if you haven't clicked on it yet, take a look because it's very beautifully illustrated. So next, I will turn it over to my colleague, Dr. Rabia Rahman.
Hi, everyone. So a lot of people who work with or know transgender individuals describe feeling inadequately skilled or versed in what seems to them like ever-evolving terminology. So we wanted to make sure that we shared some key terms for you to reference as we have our conversation today. So this is certainly not an exhaustive list, but it is a good set of definitions to get you started. I'm not going to read all of them to you, but I do want to take a second to define transgender, since that is the focus of our talk today. So what does it mean if someone's transgender? It means that they identify with a gender other than their sex assigned at birth. So if someone's born with the vagina, ovaries, XX chromosomes, they would be assigned female at birth, but their gender identity might be male or non-binary, so then they would be considered transgender, compared to someone who's cisgender, right? That is that their gender identity matches the sex that they were assigned at birth. So I was assigned female at birth, I identify as a female, therefore I am cisgender. Next slide, please. I'm not sure how many of you guys have seen this gender unicorn before, but we really like it because it visually depicts some of the constructs and key terms that we had on the previous slide. But it really just shows us how gender identity, expression, and physical attraction, and even emotional attraction, all exist on a continuum or across a spectrum, and that gender identity may differ from gender expression, which may also differ from sexuality. Now that we have sort of a very basic foundation set, I'd like to move into a conversation about the transgender population and health gaps that are so evident as a result of a number of different factors. And we still don't know as much as we'd like to about the health disparities in the transgender population and the transgender community, mostly because there are few national health surveys that ask about gender identity in a manner that would recognize transgender people. But we do have bits and pieces of the picture. In fact, when you look at the data and the information that's available to us, I would argue that discrimination and abuse of transgender and gender non-conforming individuals is part of the social and increasingly legal convention in the United States, because it is just so pervasive. And according to the ACLU, legislators have introduced more than 120 bills in 2023 alone that specifically target the transgender population. So their freedom of expression, their safety, and even access to healthcare. So health disparities in the transgender community are multifactorial, that's a given, but they can be placed into three large buckets. So the social determinants of health, bias within the healthcare system, and then overall stigma and discrimination, both overt and under the surface. So what are social determinants of health? They are conditions that surround us, right? So these are the conditions in which people are born, they grow, they work, they live, they age, and the wider set of forces and systems that are shaping the conditions of daily life. So that's the WHO definition of social determinants of health. And they include things like housing and culture and education and gender, and even access to healthcare. But what's important to note is that social determinants of health will play a role in the well-being and health of all individuals, but these factors disproportionately affect the health outcomes of the transgender population. So in the transgender population, some of the relevant social determinants of health are things like chronic stress, higher rates of homelessness and unemployment, and then also frequent victimization. A second contributor to health disparities is bias in the healthcare system. When you can switch sides, please. Is bias in the healthcare system itself, which is not entirely separate from social determinants of health, even though I'm talking about them like they're separate things. Now, when you look at healthcare in the context of all of the other discrimination against the transgender community, it certainly isn't surprising, but it is very disappointing. So disparities in health and healthcare among transgender people have been documented in a lot of research, but a growing body of literature really is supporting the fact that stigma and discrimination themselves are really fundamental causes of these health disparities, and that transgender individuals face a common set of challenges within that healthcare system. And these challenges range from things like access to healthcare coverage, culturally competent care, and even state and federal policies that really reinforce the stigma and discrimination. So what does it look like? It looks like lack of access to care, lack of culturally competent care when it is available, and issues with insurance coverage as well. So that's a very broad look. In the next slide, we'll look at some of the specifics. So Whitney, you can switch slides. Thank you. So stigma and discrimination are undeniable negative contributors to the quality of life and the health of transgender individuals. And there is clear and demonstrable evidence that transgender and gender nonconforming people really and truly bear the brunt of social and economic marginalization. And why is that? It's solely due to their gender identity or expression alone. And at the risk of sounding preachy, I really want you to stop and think about that for a minute, that this is a population that suffers from pervasive and persistent discrimination and stigma. Why? Only because they do not fit society's binary definition of gender identity and expression. So here, what we have in the next two slides are results from the Transgender Discrimination Survey, but a 2022 US Transgender Survey just completed their data collection, and so they'll be giving their results in 2023. So I'm hoping that we see improvements in these statistics. But overall, what we've seen is that there are disturbing patterns of mistreatment, discrimination, and disparities in the transgender community when it comes to the most basic elements of life. So finding a job, having a place to live, accessing medical care, and even enjoying the support of family and community. And poverty and unemployment are significant issues in the transgender population. However, trans individuals of color have even higher rates of poverty and unemployment. So that combination of anti-transgender bias and then persistent structural racism is especially devastating. So the discrimination can be seen everywhere. Like you can see here in the education system, in the healthcare field, in the housing sector as well. So let's look at the healthcare field really quickly. So about 1 in 3 transgender individuals will report having at least one negative experience related to being transgender. And that includes things like straight up refusal of needed care, mistreatment, verbal harassment, even reports of physical and sexual assault in hospital settings. But the end result of this bias that appears to be built into our healthcare system is the avoidance of necessary treatment by transgender individuals. So this is the care that they actually do need, but they're avoiding due to fear of being mistreated or disrespected. Next slide, please, Whitney. Now, you can go to the next slide, Whitney. Lack of education and training of healthcare providers is consistently cited as a limitation in providing gender-affirming care. And this is cited not only by the providers themselves, but even the patients who have often reported that they had to educate the providers on the type of care that was needed. So there's been a lot of attention because of that on the training of healthcare providers. And this attention on the education of existing healthcare providers has resulted in the publication of practice guidelines, so that's good, and continuing education opportunities. But less attention and focus has been directed towards the clinical education of future healthcare providers, so the ones that are going to go out into the field. And if we look at the current state of education, the majority of medical students, which is where we get most of our data in the US, shows us that these medical students are not getting any training on transgender health. Now, educational interventions aimed to enhance student preparedness to care for the transgender population have rapidly advanced. That, again, is a good thing. And these interventions have included a lot of different strategies. So didactic lectures, case scenarios, online modules. And when you look at the different programming, some interventions have been more robust than others, but ultimately what they were looking at was outcomes related to student knowledge, their attitudes, their beliefs towards the LGBTQ population, their comfort level or confidence in providing culturally appropriate care, and even looked at their actual clinical skills. So do these interventions work? The short answer is yes. So the evidence unequivocally supports that educational interventions can significantly improve student preparedness to care for the transgender population. And the good news is that it doesn't take a lot. As little as 1 or 2 hour lectures can improve students' attitudes, their knowledge, their comfort level, and clinical skills in providing gender-affirming care. So if we want to provide gender-affirming care ourselves, or if we want to play a role in creating a healthcare workforce that is culturally competent in treating transgender individuals, we really have to create and administer curricula within our respective disciplines that teaches our students to be those inclusive providers. And so training of our students is necessary, and that's where our toolkit comes in. So on the practical steps on how to do that, I'm going to hand it back to Dr. Linsenmeyer.
Thank you, Rabia. So in this next section, like I said, this is sort of what I think of as like the meat and potatoes of the toolkit, where we'll present an overview of those 7 strategies to advance inclusion of trans and gender diverse identities in clinical education. So the first strategy is to position transgender educators as the authoritative voices on their own lived experiences in healthcare. So it's one thing for us to read those stats from the US Trans Survey, but it's a whole different experience for students to hear directly from the trans community, someone sharing their own lived experience. We've held an interprofessional transgender health education day for the past 2 years, and by far the most impactful session has been the panel discussions, where panelists have shared their own stories of, hey, this happened to me at my doctor's appointment, or hey, this is what my doctor said to me, and this is how it made me feel. So it really brings those statistics to life and humanizes them in a way that like numbers on a slide just can't do as effectively. And what we've observed with SLU with this approach is that students can really kind of see those themselves in those future scenarios and how they will respond or want to respond when caring for a trans patient. So how do we make this a reality? I'd say in an ideal world, a clinical program's faculty makeup would include trans and gender diverse educators. We know that representation of gender diversity among our faculty and our preceptors can ensure that gender diverse students feel included if they can see themselves in the profession. But when a program's faculty makeup does not reflect much gender diversity, educators can seek partnerships with the trans community. This approach can not only position trans individuals as the authoritative voices on their own lived experiences, but can foster a powerful and memorable learning experience for students, and can help to build relationships with transgender community members for future and ongoing collaborations. So this could take the form of lectures provided by transgender educators, panel discussions, or community forums. So like Dr. Rahman mentioned, current research supports that as little as a 1-hour lecture can effectively improve student knowledge and attitudes towards the trans population. And in St. Louis, we have this amazing oasis of community-based organizations that we can draw on, a number of which we have included at the end of the presentation today that are linked. I also have permission to share the information of the educators that we've brought into SLU in the past. So if you would like their information, you can feel free to email me directly, and I have their permission to share their information so you can get in contact with them directly. The next strategy is to start with gender affirming communication. A lot of times in my profession, when I'm working with fellow dietitians or nutrition students, they tend to want to get right into the weeds of like how does hormone therapy impact bone mineral density and like what can nutrition do about it? But we emphasize this as a critical strategy to start with because it really does span all healthcare disciplines. So regardless of whether a student will one day be directly involved in the provision of gender affirming medical interventions like hormone therapy or surgeries, students in all healthcare disciplines with direct patient contact will likely care for trans patients. So we start with gender affirming communication as it demonstrates one way that we can show respect for the patient and honor their gender identity. And we know that gender affirming communication is a skill that can literally be life-saving. I always cite the Trevor Project, which reported that more than half of trans and non-binary youth seriously considered attempting suicide in the past year. And then those that had their pronouns respected by all of the people in their home attempted suicide at half the rate of those who did not have their pronouns respected. So I'm not going to go deeply into the principles of gender affirming communication here, but I will say this is like another excellent opportunity to contract with an educator from the community who can share their perspectives and provide this type of training because it's not necessarily discipline-specific content. The third strategy is to educate students on the broader historical and socio-political context of transgender health. We may be, I think, initially inclined to limit our training to those topics that really have a direct relationship to our own disciplines, but we would be remiss not to acknowledge the broader context of transgender health. If you watch any of the local or national news right now, you know that transgender health is being heavily debated by state legislators, including in Missouri. In fact, literally as we're speaking this afternoon at 2 o'clock, there is a protest for trans rights at the Missouri State Capitol against the anti-LGBTQ plus legislation. We know that 15 bills have been targeted Missourians related to gender affirming medical interventions and sport participation just this year. So many of us may be inclined not to address the political backdrop of healthcare, but the reality is that decisions are being made about healthcare by legislators. So we don't have to assert, our own opinions in the clinic or in the classroom, but we have to have an understanding of this backdrop or this broader context. Next, the strategy is to incorporate transgender health throughout the curriculum. And this is just good pedagogy where we know that, we can improve student knowledge and information retention when we cover topics multiple times versus, just a single mention in one class. So with this strategy, we can normalize how we teach students about sex and gender versus framing it as like a specialty topic. And here I have noted just what I call kind of several touch points in a sample dietetics curriculum, since this is my discipline, but I think much of this may overlap with other medical and allied health disciplines. So in a medical nutrition therapy course, we could address gender-affirming medical interventions and then the related nutrition considerations. In a nutrition counseling course, we could practice those gender-affirming communication skills and could go deeper into a discussion of the interplay between body size, shape, and gender expression. In a nutrition assessment course, we could identify the sex-specific aspects of nutrition assessment, for example, calculating energy needs or the boy-girl growth charts and how to manage that sex-specific data. In a nutrition in the life cycle course, just like we address other aspects of identity development throughout the lifespan, we could also address how gender identity develops and throughout childhood, adolescence, and adulthood. And then lastly, in a research methods course, we could examine how sex, gender, and sexual orientation data is collected in research settings or in federal level nutrition surveillance programs. So now I will turn it over to my colleague, Emily Buxbaum.
Thank you. So happy to see everybody here, and thanks for joining us, and to see some speech language pathology colleagues and clinical preceptors out there. I'm here to talk to you about clinical education, clinical affiliations, and how do we ensure that we're not only infusing teaching and learning around transgender and gender expansive folks in our didactic programs, as Dr. Linsenmeyer was talking about, but also within our clinical and professional training programs. So first off, if you are in a position like mine, you work very closely with your clinical affiliation sites. If you are somebody that it has the ability to reach out to clinical affiliation sites, we recommend that you seek clinical affiliations that are gender affirming, or start to at least reach out to communicate your desire to know more about what processes that they may have in place to support trans and gender affirming students. And do they provide trans and gender affirming healthcare if it's a healthcare organization? Most of our programs, most of us are working in clinical healthcare programs that are here on the call today, or educational programs. All of these rely on strong clinical affiliations, places where our students receive important, necessary clinical training, and that are partners to our program at SLU or to many other universities that you might partner with. So we know that our clinical affiliations may include healthcare sites, educational settings with providers who either provide gender affirming medical interventions, like may work at a gender center or at a healthcare center that's affiliated with a gender center, or maybe healthcare providers or education professionals who simply model gender affirming communication and care. Both are important considerations when considering where to send a student and with whom that student is going to be learning from. So identifying potential clinical affiliations in your own region. If where do you start? Sometimes we feel like if you are somebody in a position like mine, to reach out and find clinical affiliations, talk to preceptors, try to find folks that in the community that are willing to support, educate, mentor your students. Sometimes it could feel a little bit like the wild, wild west. And where do you start when it comes to trying to find folks that may be willing to model and provide clinical education that's gender affirming? That can be tough. I recommend certainly starting by communicating with your sites and your preceptors, sharing information like that you've learned today, or that may be provided to you by from other sources. That helps you clearly communicate that your program is supportive and welcoming of students of all gender identities, and you'd like to ensure that clinical education can do the same within the community. There are gender centers, the list of gender centers that are published by the Transgender Legal and Defense Education Fund. There's an interactive map of clinical care programs for gender expansive children and adolescents. So we want to make sure that, we can, that interactive map of gender expansive children, gender programs that provide gender expansive care to children and adolescents is maintained by the Human Rights Campaign. So that's available publicly. So we, as clinical educators in a position to send students out into these clinical sites in the community, we want to consider where we may access friendly and affirming clinical education for students that may be transgender or gender nonconforming, or just students that for whom it is a priority to surround themselves with educators and experiences that affirm and support gender expansive individuals. Consider, of course, the size of the organization. Here in St. Louis, of course, we are, fortunate to have a large population, but students who may be going to clinical education sites that are in smaller or more rural communities may not have the luxury of having access to a large queer or gender nonconforming community. So we'd like to consider, is there an alternate route to send a student to an area that has a larger metropolitan or community where they can access more support from their own community or from the queer or gender nonconforming community? Do you have a relationship with a clinical site in which you can draw on past experiences of students? Have you heard from other students that have gone to places before about when can you gain some information by talking to students who have been at a site before to ask about the policies and procedures they may have in place for trans or gender nonconforming students, employees, and workers in their organization? And here at SLU, of course, we have clinical spaces on campus, including the clinic where I am sitting right now, that provide gender affirming care and that students may rotate through for their clinical experiences. Can go to the next slide. So we're going to talk about how we can, as a clinical training program, create safe and inclusive spaces for transgender students or gender diverse students. This goes back to the learning environment as a whole. We could be proactive. We can ensure a safe and inclusive learning environment for our own transgender and gender diverse students. But this requires broad, multifaceted thinking. We have to consider things like policies, resources, infrastructure, culture of your organization, of your university, or if you are coming to us today from not in a university setting, what does your organization's culture look like? What are the physical spaces of that environment? What are the physical spaces here in our own learning environment? All aspects for sure are beyond the scope of the toolkit that we've published, but we want to talk a little bit about strategies that, especially in an educational environment, we can uphold and push forward to create safe and inclusive spaces for our students. I will say that just anecdotally, as somebody that's on the committee to admit graduate students, I would say in the last 3 to 4 years, I'm seeing more and more students who are self-disclosing and talking about their gender diversity as part of their application packet. I think that, 5+ years ago, we were maybe learning those things about students incidentally, or maybe in private conversations that we were having with students. And now I'm just seeing more and more that students are applying for programs and being very forward and out with that identity, and may even be talking in their essays or interviews for admission about their gender status and maybe its impact on their learning or any experiences that they've had in the past. So, which is a wonderful thing, and really points to why we must create a safe and inclusive environment for the students once they get here. So we want to really consider all aspects of our environment, which includes policies. So if you are in a position of privilege in your department, in your work setting where you can influence policy, if you can publish and uphold a program policy, if you can maybe change a program policy, wonderful. If you can't, if you can push forward the policies that are already there that prevent discrimination on the basis of gender identity or sexual orientation, highly recommended. If there is a university or an institutional level policy that is in existence, emphasize and endorse that policy. Make sure it's included in student handbooks, course syllabi, training materials, possibly for new employees at your organization. Locate resources, disseminate resources that are devoted to LGBTQ folks. Here at the university, we have people publishing information. We have LGBT student organizations. We can point students in where to find all gender restrooms. There are available resources in the university for how students who may need information on a name change or how to find appropriate campus housing. So for students who are not gender conforming. So creating and cultivating these resources, list them, make them available in your student handbooks, or if you're somebody that's, in a private organization, maybe in your employee handbook, create, maybe one-page handouts, or make sure things are included in the information that employees, colleagues, and students receive. You can also facilitate a culture of communication. Set tones for your program by modeling gender affirming communications in your classrooms, in your meetings, at your social events. Introduce yourself, of course, as a starting point, and only a starting point. Introduce yourself with names and pronouns. Honor the names and pronouns of others. And feel free to correct those who may misuse or use an incorrect pronoun. Consider your physical spaces in your campus, in your workplace, in your clinical setting that may reflect and promote a gender binary. So things like bathrooms, housing, units might be designated in a hospital or a clinic for men or for women. Advocate for increasing gender neutral language when available, when possible, to ensure that people of all gender identities are welcome and included. And then I'm going to talk a little bit about ongoing education in transgender health, because this is not a 1 hour thing or a 1 day thing for sure. Emphasize the value of continuing education on transgender health within your organization. We have to infuse examples into how we clinically train our students from day one. As Dr. Linsenmeyer said, there are things infused in the curriculum, and in my program, there are things infused throughout their clinical training as well. Simulations and standardized patients can be thoughtfully used in a way to promote gender affirming care. We can choose simulated clinical experiences for our students that show a gender expansive or transgender patient. We can assign materials and readings, articles by and about trans or LGBTQ folks, to infuse that into clinical training as well. Ongoing continuing education is what we do as healthcare providers. So modeling that as well to our students, talking about clinical education, professional education and ongoing education that you yourself are attending is a great way to model for your students in clinical settings as well. Webinars, trainings, and conferences are all great ways to get your own education, which then you can filter down to your students. In my particular program, I will give just a couple of examples. As a speech language pathologist, of course, we deal with voice, we deal with communication. Within our scope of practice in the last several years, we have added in specifically gender affirming voice and communication. So as a part of our scope of practice, it is something that all of the students in my program get exposure and experience with, bringing in from the start information into lectures as well as guest presenters. And then if they are training in the clinic with me, my students do receive a rotation where they're doing clinical work directly with transgender individuals, providing gender affirming voice and communication. When I start that with them, I have them reading materials and a textbook, as well as articles, as well as videos and simulations to build their skill and knowledge base. We start by exposing them to understanding of the fundamentals that we talked about earlier, the disparities and the barriers in healthcare access, so that they all have a good understanding of the population. and the issues surrounding the population, co-occurring things like mental health diagnoses to be aware of that are commonly occurring. And then when we get into the clinical aspect of it, they're able to have those hands-on clinical experiences in a training environment in our clinic with me as their supervisor, so that they can move through a semester of learning of actually seeing and doing, and as was mentioned before, making what was sort of what appeared on paper to them before, making it very real, and hitting home some of the concepts of how we work and provide best care to this population. And I believe I'm handing it over next to Dr. Heiden-Rootes.
Me, but so.
Sorry, Dr. Drallmeyer, I apologize.
No problem. So hopefully we just wanted to take a little bit of time, hopefully where I will be talking very little. We recognize that we are not the only people at SLU that are doing work around gender diverse healthcare and trying to advance inclusion of gender diverse patients and students and faculty members. So we have some questions, some of which were actually suggested by audience members, so that is appreciated, that we felt were particularly relevant. And we want to sort of hear from what you all are doing, with the thought that maybe this can be a space for collaboration where we all can learn from each other as well. So I think the first question is the one that we were hoping to emphasize the most, which is within the context of SLU as a Jesuit institution, how can we as faculty and staff support our transgender and gender diverse populations while reckoning with a cultural and religious history that has made this group feel unwelcomed and or threatened? So I know that we probably all certainly have some thoughts around that, but I would love to hear from the audience if you all have things that you might want to add.
Does anybody have experiences with this in a religious context that they can speak to? Or, yeah, there's a hand up. Lori Jones?
Well, not so much that I have experiences with this, but I almost feel like we have people being two-sided about this. So, their religion teaches them one thing, but they know they can't act on that in the classroom. But I wonder if we are, we're not optimal because of that two-mindedness.
Lori, can you expand a little bit on the not optimal? What are you thinking of when you say that?
I think that, religion is really a strong factor in how people act. And so I think that somebody whose religion tells them that being transgendered is wrong is maybe going to do the minimum that is required by their job or by this Jesuit university to be appropriate, but not fully inclusive to that individual. Does that make sense?
Yep.
We're going to give the appearance without really giving the real substance or the real going all the way with inclusiveness.
Mm-hmm. Mm-hmm.
I know that in the Trans Health Collaborative and in the Interdisciplinary Health Education Day that we've held 2 years now, we've had speakers and contributors from the Catholic community, from the religious community, who do share a very important point of view from their religious teaching on why providing inclusive care is part of their values and why it is a spiritual and religious mandate for them to include this community. So, it just has always been interesting to me that the religion can be used as an argument against and very much an argument for practicing trans inclusive care.
Yeah, I was going to say that I feel like that has been, in my experience, that has been often where we find the most success with students when we talk about sort of our ideals of promoting human dignity. That, I mean, nobody can really argue against that, right? So I think the more that we're able to really frame this as something that's really important to caring for our patients or our students as whole persons, regardless of what your religious or political beliefs are, that's where we've often had success. I also feel like we have encouraged conversation to an extent. So within the Interprofessional Transgender Health Education Day, we've done like a discussion board afterwards where there are certain questions that students can respond to, and then they're also asked to respond to comments from one another. And I think there's been really interesting and healthy conversation. It is not anonymous, of note, so people have to be held accountable for what their responses are. But I think there have been people sort of on both sides of the issue that have put up very thoughtful commentary that I think helps us all to understand where the other side of the issue is coming from. And I think that so sort of taking on those issues rather than trying to ignore them, I think has been successful for us. And I also saw that somebody put up a question in the chat about religious leaders involved in gender affirming initiatives. And somebody correct me on this because I might get this wrong, but the American, what is it, AJCU, Katie Whitney, they have, there's actually a statement out on the importance of including education around gender diverse individuals within our Jesuit institutions. That certainly can be used as sort of a backdrop for why these conversations are really important for us to have.
Yeah, I'll go find it, Teresa, and put it in the chat.
Okay, that would be great. We have other questions, but I also I know we're getting short on time, so I wonder if I might just go ahead and turn it over to Katie to talk a little bit about working with students that may have resistance, because I think this is a big topic that's important for us to discuss.
And in some ways that conversation leads right into this, right? So you're going to have to plan for and anticipate struggle. I think we cannot be, and I will argue, I will admit I have been naive to think that if we just give them the information, if we just show them the science, if we show them the outcomes, that people will come along. And that is true for a large group of the students we've interacted with. I think that's true. I'm going to throw out a percentage, 90% of the students, maybe more. I think generally it's a great strategy. You will always have students who are struggling, and the struggle can look many different ways. And sometimes it can look very contemplative. It can look very thoughtful. It can have, you know, they could be really engaged with you about it. And I've had those students, and those are fun. Those are fun moments where this student is doing the work, right? They're in the middle of figuring themselves out and where they can sit given their religious or cultural beliefs. One of my current doc students comes from an LDS Mormon background, and him and I have had great conversations. He's working through it, right? He's trying to figure this out for himself. Those are actually the easy students. The resistance can look much more difficult than that. And one of the things when we really sat with, like, what's going on for these students in resistance? Now they behave in different ways about it, but what's going on for them? And there's a few things I want to highlight for you all. The first is what you are looking at when a student is in resistance around learning is some degree of anxiety about what you're confronting them with and how it sits in opposition to everything they've been told their whole lives. And I'm the product of a pastor's kid in a very conservative part of middle America, right? And so I've been confronted, right, multiple times, and it brings up an anxiety because it exposes the things you were told, the things you might not know, and some embedded biases you might not be even aware of. And so I'm a mental health professional. So when I see anxiety, my impulse is to go, ooh, what's that? And to get really curious and open with the student. I think sometimes what I have missteps I've seen educators do is they get equally anxious, equally biased in their own approach to that student in terms of closing down or saying, well, this is just one of those students, as opposed to becoming engaged with them around the anxiety and what's happening. I want you also to be aware, and this is, again, me, the mental health professional, but these feelings of anxiety and bias happen before there's behavior. So there's no like talking people out of feelings. There's only sitting with them and acknowledging them. And so you want to be aware when you see them happening in the room. I recently took a personality test, and my interpersonal sensitivity is as high as it can get, which actually makes a lot of sense to me now. But you have to be watching what's happening for your students and tuning in to where they are so that you can make an appropriate, judgment of what's happening, but also intentionally engaging that student who's struggling. The second bullet point there is actually what you were talking about, Teresa, which was that need for reflexivity. We need thoughtful questions. We need students to engage with this. Reflexivity turns the question on the self. So it's the student going, ooh, what was happening for me? And I think that's a vital part of what we have built into our curriculum, is that there is time and space for the students to do that. On our Trans Health Day, for example, this last year, we invited in Patrick Cousins from our, oh no, now I'm going to blank on the name of the office he is in. Could anybody jump
Campus
in?
ministry.
Thank you. Campus ministry. And he sat with students and their questions. And they need that. They need that kind of, I'm going to call it pastoral care, right? The sort of attention to where they're at. And I think that's part, though, of Ignatian Ignatius pedagogy. Goodness, that word. For giving students time. I offer in there a couple of questions that I use with my students. How does someone become gay, bisexual, lesbian, transgender? Because when you start digging at how do you think this comes about, you start hearing the bias and you start hearing the origins of kind of where the information came from so that they can become aware of it. That third bullet point, and there's more in the toolkit, is that education alone will not work for these students. They're on probably some kind of their own existential personal journey, but you can be a part of that as their faculty member, as their preceptor, as their mentor, whatever your role is. And for me, I always try to stick close with as much compassion that I have for them too, as whole humans, and also, wanting to honor their process, right? The journey they're on. Now, that doesn't mean that we allow for, let's say, transphobic things to be said. I mean, this is the part where we have to think about civil discourse, and we have to think about how do we talk about this in ways, even if you're struggling, that becomes instructive as well. So I'm going to stop there because it is 2:53. And I also want to give folks time to ask questions or talk and do whatever we need to do next, Whitney.
There's already a great question in the chat, Katie, who I think you might be best suited to start to talk about what efforts can be made to include parents/support system of a transgender student to promote inclusivity. Are there any recommended strategies or a game plan? I'm assuming that this person is referring to a student here at SLU. Maybe this person is a faculty member here at SLU. I'm not entirely sure. What are your thoughts on that?
So, I mean, we have several trans students in my program and others I've met across campus. Support systems are central. I mean, if we go back to Rabia's slides about health disparities, one of the big things you can do for any trans person is to activate a support system for them. That could be in terms of affinity groups. So we have LGBTQ organizations here at SLU. There's also organizations in town to get them connected to. We have some of those resources in the following slides. So it's really about networking around them and helping them get connected, because it's really that isolation, that disconnection when you start to worry about folks' mental health and health in general.
Pointing them to the available resources here on campus, but also in the larger community. And if you don't know what those are, kind of just helping reach out to even to this network right here, and maybe we could point people in the right direction if folks are here at SLU with what's available here and in our broader community.
There was another question in the chat about, has SLU explicitly stated where they stand in terms of the AGCU stance on transgender students and staff?
No.
Yeah, I didn't think so.
That letter has been presented. Fred Costello has seen it. Our student development folks have seen it. The folks that I work with in DICE have seen it. So it's making its rounds as we're figuring out sort of as an institution what to do with it. But no, there's no official statement from SLU about it.
There was another question about, do you think the few states that are banning gender affirming care, that those students may be reluctant to divulge details regarding their gender identity, or even reluctant to apply to universities in those states?
Yes. Yes, well, or maybe because the current generation, I don't think has much, what's the word? I'm going to try really hard not to swear here, Whitney. They've got, the current generation of young people is ready to move on from this topic. And so I think we're in the midst of some generational disagreements about what is or isn't considered perfectly normal, wonderful, and to be celebrated. Oh, there's a hand up. SLU ADHD Research Lab.
Hi there, can you hear me?
Yep.
Okay, great. I'm wondering, I really appreciate this slide about, being there along the journey with students who are figuring it out. And then you said, but then there's the point, of course, we're not going to let them say transphobic things or harmful things to patients and clients. And so I'm wondering if you have any guidance along where that line is, how you've reached a point that this is a real problem when we're beyond, like it's a competency issue.
Yes, that does exist. I think, the struggle for me for a long time, given this line of work, is and being faculty, right? I mean, of accredited graduate program, right? Where I'm asked to uphold the ethics and the accreditation standards of my profession, which also means we serve a gatekeeping function. And I think there's a place, and I hope every graduate program has a process for offering professional feedback to students about kind of how close are they coming up to that line of crossing over into unethical and maybe malpractice, right? In terms of what they're expressing and the way that they're talking. And so I think you have to have some kind of process in place, and frankly, like your program, whatever your clinical program is, some level of agreement between faculty and administrators about our level of room for growth. And then when we begin to say, the student might need to be mentored out of the program if it's sort of this pervasive for them.
Absolutely. And I'll add to that, like when something is within, not only within the scope of practice for your profession and you're an accredited program, and students need to show a level of competence with a certain topic, and you can always kind of bring that discussion back to that with the student, but also what are our professional ethics for non-discrimination, for provision of services, and what could this look like for the student in the professional environment, and kind of walking the student through some professional scenarios that they may encounter. I've worked with students who say, well, I'm only ever going to be a school-based speech language pathologist. I'm not going to provide gender affirming voice and communication. Okay, and that's wonderful. And I'm sure that is what you will be. Do you think you're never going to come into contact with a child who discloses to you that they are trans or non-binary? Do you think you're never going to have interactions with parents who might be LGBTQ or trans? So what do we need to know in order to be competent to serve this population? What's within our scope? What's outside of our scope? And what crosses ethical boundaries and may border on, discrimination that, would be like a hard line for us, right? And so it's really important, I think, and it goes back to that when we do clinical education with our students, teaching them to unlearn, right, their own. This goes back to implicit bias and this kind of DEI training that we can infuse about all kinds of things into our curriculum, is how do we unlearn and question our own biases and then learn new terminology and ways of approaching situations and ways of thinking. And that is incumbent upon us as educators, and particularly clinical educators, because our students are watching us do the job. And they're modeling the way that they communicate with people based on what we do and say and how we approach problem solving, and talking through problem solving and critical thinking is really, really important for us that do the work of clinical education. There's a wonderful chat, just kind of like somebody shared in the chat about this, goes back to providers, teaching students who are going to become providers, like this OBGYN in question in the person's chat comment that continually asks the patient about their husband. These are the things that we have to unlearn and then relearn how we can just say spouse or partner. Like, it's not that hard. But when we've been saying, is your husband here for an appointment, maybe our whole career, then it becomes something we have to actively work on. So modeling for our students how we have I have been very clear and honest with my students about how terminology and words that I was using 20 years ago or in the 90s, there's certain things I would never say today. And why, and what changed my thinking on those, and how did things change in our field and just in our culture to inform my personal and professional approach to things.
So we are at time. I want to acknowledge we're at 3:00. I can stay on if folks want to continue with some Q&A, but we want to extend our gratitude to you all for being here, for wanting to know more about this topic that we obviously feel very strongly about in this group and want to support this community. So thank you so much for your participation. And again, me and some of the others are going to hang out, and we're happy to continue some of this conversation for those who need to. So thank you again.
And these last slides that we have linked here are just additional resources. So other organizations and websites, those St. Louis-based organizations that we mentioned that have been excellent partners in this work, and then additional books and workbooks, some key publications, some really great webinars specifically from the National LGBTQIA Health Education Center. And then we know we have people coming from different disciplines. So at the end of that toolkit, we have even more resources broken down by discipline.
And all the resources are linked, right, Whitney? So if they open the slides I put in the chat, you can open them and the links will go right to all the resources.
Yes.
Thank you all so much for being here and for allowing us to present this.
Right.
Okay, so
yep, go ahead.
This is Angela, and I'm going to ask a fairly technical. So since clinical trials are usually done on sex and not gender, how, as a librarian, can I inform people to look at that when they're doing searches? Does that make sense? Because like when you're treating someone, do you look at the gender or do you look at the sex?
Well, I think it depends if what your topic area is
Okay.
dependent on. So I'll give you an example, right? Like if I'm studying suicidality, gender identity is what matters, right? Because
Okay, so like
go ahead.
when you're doing a search and database for library resources. Some of those are not going to have that in there. They're just going to have the sex and not the gender orientation is, I guess, how to like create awareness to students that that's something they need to consider. So, because basically, since when I teach that's something I can bring up.
Yeah, I think that's something you can point out. Sorry, Whitney, go ahead. Were you going to say something?
Oh, I was just gonna say, I feel like this topic has really been advancing, specifically in this past year. The National Academies had that publication that came out last spring about their recommended language for querying sex, gender, identity, and sexual orientation. And that was intended for research, clinical, and administrative settings. The reality is it's not happening like that right now. So I think in terms of like, what can we teach students, like kind of pointing out that gap. And then another major publication that came out was the end of January of this year, when the Biden administration basically put a call to the like federal agencies that do research. So for us, that's like the NHANES data that we're kind of keeping a close eye on in nutrition. And essentially was calling them to like initiate a process to figure out how they're going to do better data collection for those measures. So I see it as like right now where we're sitting is like recognizing that there's definitely this big problem in clinical research, and we're going to be observing or watching in the next couple of years like how agencies are resolving that.
I put a resource in the chat that you may or may not be familiar with. So all of this is the clinical trials by the National Library of Medicine trying to recruit patients of diversity. I'll say it that way. It could be any kind of diversity. So that's just a subnote.
Thank you for sharing it. I'm going to check it out.
Any other questions?
I had a question. I am at the School of Nursing, and we had a situation where students had verbalized to some of us that a faculty member had said like very hurtful, inappropriate comments in a class. And so they told me, and then I told their program coordinator, but then basically I just kind of let it sit there because it was hearsay, and I was told the students have to say something to the administrative people themselves. But is there a mechanism where we're concerned about comments and behaviors that are really hurting our students that identify as gay or trans? What do we do with that?
I put a link in the chat. We have a bias reporting system at SLU. This would be an example of something that could be reported by the students. It's best if it's a first person account of what was said and the impact. And so I would encourage those students, particularly, I mean, when you think about, going to, if you say to a student, well, go to the program director or the department chair, that person may not be affirming or might not be receptive about it. And so, and for some students, that's a very intimidating prospect. I think that's a good, I would prefer that, particularly if that program director or department chair, whoever is overseeing that faculty member, could step in and we could trust they could do that. And I think that's true for a lot of folks. There are situations though where going right to the bias reporting is good for students too. It's a mechanism that's reviewed by folks in our general counsel office. It gets investigated. Faculty who are investigated don't lose their jobs, but they might, we might start identifying faculty who are also resistant to this kind of education, which sometimes the intervention is about educating and intervening with that faculty member, that kind of thing. So I would send students here too. It also documents if this becomes a regular occurrence. And, it's kind of like with students who are struggling, we need to document that in the event that we have to do some gatekeeping, if that makes sense.
Yeah, Gotcha. Thank you.
I would assume also Title IX could play into that if there's like a repeated, if this becomes to the level of something that could be considered sexual harassment, if there's comments being made against, you know, a group or a specific person that may be based on gender, sexual orientation, that nature, and it rises to the criteria of sexual harassment. I guess Title IX could also be an option for reporting through SLU. I'm not sure of the situation.
Well, thank you everyone for your thoughtful discussion today and for hanging on for a couple of extra minutes. Yep, we so appreciate your time and the privilege of gathering together and discussing this topic. So we'll go ahead and end it now and enjoy the rest of your sunny afternoon.